Morning, everyone, or good evening, wherever you're joining us from around the globe, and we want to welcome you to our All Children Reading, a Grand Challenge for Development in Spotlight webinar in observance of International Day of Persons with Disabilities. We're really glad to have each of you joining us on the call today. My name is Michelle, and I'll be your host for today's webinar to share with you the work of two innovators from round one of All Children Reading. Today you'll hear of the work they've been doing to improve literacy for children with disabilities and the lessons learned from that work. I hope that what is learned and shared today will strengthen the work of all of us as we're working to increase early grade reading outcomes for children in developing countries, including children with disabilities. We begin with our innovators. I just want to take 2 minutes to provide a quick introduction to those of you who might be new to All Children Reading. A Grand Challenge for Development is a competition that is leveraging science and technology to create and apply scalable solutions to improve literacy skills, particularly for early grade learners in developing countries. Round one of All Children Reading launched in November of 2011, and it was a $9 million grant competition. And that competition focused on two areas, which was teaching and learning materials as well as education data. Announced the winners to the grant competition in September 2012, and those were 32 winners working in 22 countries, and you'll hear from two of those winners today. We've launched round two of All Children Reading this year in February, and this round includes both a grant and multiple prize competitions. In this round, we are focusing on three areas, which are mother tongue instruction and reading materials, family and community engagement, as well as children with disabilities. Our first presenter is going to be from Perkins International, but before we get started, I just wanted to mention a couple of housekeeping items. I just want to share that the presentation is being recorded and we will be sent to you after the webinar today, and it will also be posted on our website. You'll see a drop-down menu item called Webinar Archives, and you can find it there. If you suddenly experience any audio problems during the WebEx, we recommend that you just log out and back into the WebEx, as that seems to solve most issues. If you have issues, feel free to use the chat box, which is on the right side of your screen, and send a message to the host, and we'll see if we can help you figure that out. Also, I want to remind you, as each presenter is giving their presentation today, as they present, please feel free to chat your questions to me, the host, and those will be ready for when the presenter finishes. Each presenter will have about 15 minutes for their presentation, and then we'll have 15 minutes for Q&A afterwards. So feel free to send those questions to me as they're presenting and as you think of them. I'll start today with Perkins International, and our presenter today is Angela Offran. She serves as Perkins Regional Coordinator for Africa and is based in Accra, Ghana. Obviously, Angela headed programs in literacy, math, and science for the Special Education Division of the Ghana Education Service. Angela holds a master's degree in visual impairment and elementary education from Teachers College, Columbia University in New York. And also holds a Bachelor of Education degree in Special Education and Math from the University of Education in Ghana, and Diploma in Statistics as well at the University of Ghana. Angela is joining us, calling in from Ghana today. We're happy to have her here, and we'll just let her take over the presentation now.
Good morning, everyone. Today is World Disability Day, and I just want to wish all with disabilities around the globe and all persons with disabilities a wonderful day. So I'm going to start with the All Children Reading project. Start, I have to say a little bit about Perkins. That Perkins International, it's Perkins School for the Blind in Boston. Perkins School for the Blind was founded in 1829. So this year Perkins is 185 years old. And then we are doing a lot of work around the globe. Currently, I would say that Perkins is in more than 65 countries worldwide. And we have made an impact over 750,000 individuals that we have impacted the globe. Our focus ranges from school-age children to young adults and families and professionals who support us in more of teacher training, curriculum development, and literacy. To hear of Perkins products where we use the Perkins machines. These are all found on Perkins Pound in Boston. Why we started with this project in Ghana is that the majority of children who are blind or those who have low vision in Ghana really not receiving quality education services that promote literacy, especially within the inclusive classroom setting. Although we had these children in the classrooms, they didn't have the devices, they didn't have the materials to be able to learn with their colleagues, the other colleagues in the classroom. And that was a major challenge. And so they really were having a lot of challenges with reading. And that is why we came in with the All Children Reading to support them improve their reading. Of the innovation that came up was that in project we had to train teachers, both the special ed teachers and regular ed teachers, to be able to work with these children and to improve on their reading. Also decided that there was the need to involve families because if the parents have no idea, they cannot help their children. And therefore, we thought it was very important to sensitize the parents and to also support them to be able to help these children when they also go home on vacation. And they also thought it was that if the children are in the classroom and they don't have the devices or the materials which will help them in reading, then that would be a major challenge to them. And then one of the things we realized was that these materials or equipment are there, but they are not being repaired and they are broken down. That will also be a challenge to improve the reading because the materials that are broken, that would be, it's like basically they are not working in the classroom. So are the areas that we sought to help support these children. And that was what this project was about. It was both for children who were blind and then children with low vision in the inclusive classroom. And to say a little bit, it was found on 3 schools with inclusive education focusing on children who are blind and low vision. At Ghana, these 3 schools are found in the Longa Hafo region. We have 10 regions in Ghana. So we have the Longa Hafo region, the Volta region, and the Central region. And these were the 3 schools that the project took place in. So one thing we did as our pillars of Perkins intervention was to use the new technology and ensure that equipment such as magnifiers and braillers and computers for large print can be maintained locally. And then we also looked at the relevance and sustainability. And what we did was that we responded to the specific need that the Ghana Education Service, GES's Ghana Education Service, highlighted of building the capacity to implement the project moving forward. As a form of partnership, we worked with the Ghana Blind Union, with our local partners, and the Ghana Education Service, specifically the Special Education Division, which deals with program implementation in Ghana. The results that we realized out of this project, the first thing we did was that we have screened all the children, all children in the 3 schools, and had a total of 1,248 children who were screened. Out of the screening, had 110 children who were either blind or who had low vision and who needed this support to be able to improve their reading. So 110 children now have access to assistive technology. In the area of teacher training, we started training 11 people who were special ed teachers in low vision. What it was that we did what we call environmental assessment, functional vision assessment, and all these things were done because we needed to make sure that the classroom environment was conducive for these children to be able to learn. And so these 11 teachers were master trainers who really trained in this field to be able to also train the regular teachers in the classrooms who had no knowledge about how to work with these children. And then we also involved the people at the district. Ghana practices a decentralized system. So we involved the people at the district office, the district directors, what we call the circuit supervisors. These are people who go around the schools to monitor the activities of teachers. So altogether, we had a total of 108 people, just district officers who had instruction. Aside that, because of the Braille repair component, 9 technicians, and these were both teachers and 2 technicians, 7 teachers and 2 technicians, were all trained in Braille repair. And what it is that now if there is any problem with the Braille, these people are able to repair it, so children are not cut off from the regular class system, but can continue learning in the classroom. Out of 9 technicians, 2 of these technicians all came master trainers. They had to go to Kenya to do training in Braille repair, and now what we call master trainers who can also help us to train other people. 242 parents participated in the sensitization workshops. And out of that, 17 new parent organizations groups were formed. And we formed this group because we just wanted them to be meeting from time to time to discuss about the well-being of their children, and also to learn from each other some of the things that we took them through. What's the result of the program? What we currently have is that we feel that new centers have been put in place. All these schools, one of them, all the children have either a pen braille or a magnifier, or we now have computers and printers and scanners for these children, so that if they need to print it, get any print for it easily accessible for them. And we also have what we call the closed television, CCTV. Those children with low vision will be able to utilize that and to improve on their reading. Previously, these things were not available in these schools, and therefore these children were lagging behind their other colleagues. One of the other things that we have also realized is that the attitude of children with disabilities changed positively, in the sense that they can now also compete with their other colleagues, non-disabled peers in the classroom. And on the other hand, the attitude of the non-disabled peers has also changed, because they now know that, we have to work extra hard, because if we don't do it, our disabled peers will also take the lead in the class or something. So there has been that competitive spirit, and I feel that that is a good sign. And then one other thing that happened was that we were able to develop a low vision manual. And this low vision manual can also be used across the country in every training that we want to do regarding this low vision training. And then also the repair training manual. And so people can also use that to be able to do training. The other lessons that we learned was that real skills has improved with access to needed technology and equipment. So then they didn't have, now they have. So it has really improved. The interventions, like I said earlier, is that the children, that confidence level of a child who is blind or a child with vision has really been boosted, because now they know that when they get to the classroom, they can also have access to all the equipment and all the materials that they need to improve their reading. And one other equipment, what we call the smart braille, It's like a Perkins Braille, but it comes in print and at the same time in Braille. So the teacher is teaching the smart Braille, the teacher can see whatever has been written in print, and the child who is blind can also read in Braille. So that also has helped the teachers a lot, both the regular teachers and the special ed, because you see what a child has written and you know that the child is right or wrong, and then help the child. Aside that, one important thing that I feel was really good to give about this project also is the fact that there has been a lot of involvement with the Ghana Education Service, the parents, and the Ghana Blind Union, and all the other NGOs working for children with disabilities in Ghana, because we are looking at sustainability. And if you have the government, as in the ministry and Ghana Education Service, and all the parents and teachers and all these organizations, that would be a good way to sustain the project. There is a picture on my right hand which shows one of the teachers who is within the Perkins Braille, and he does it all the time. And the school he's teaching, the headmaster is aware of it and gives them a little support to also kind of boost their morale to be able to do the work. And that is the form of sustainability I'm talking about. The future plans of Perkins is that we really want to expand the services to the remaining regions, and what we want to do is that those TOs or trainer of trainers in both the low vision training and Braille repair training have been equipped with skills, and we believe that it can be replicated across the country. And so that is a way of also thinking about the sustainability, that we can expand these services to the remaining regions where we have these children in special schools and in the other schools that we are practicing inclusive education. Unique thing that we started, that we have what we call a Braille competition. It is something that was never done, and it's something that was introduced to Perkins in 2012. And what we did was that we bring all these children who are blind all over the country together, and they compete in reading fluency, they compete in execution, they compete in reading comprehension, proofreading, and spelling. And then we give trophies and prizes to them. And I saw that it is a way of also improving reading. So it's something that we want to continue. One aspect of what Perkins does is that we have what we call the Educational Leadership Program. And with that, we bring people from around the globe to go to Perkins to do a 9 months or 6 months training on how to work with children with disabilities, specifically children with multiple disabilities and those who are deafblind. And so with us, this is a way of also using the ELPs. We have a few in Ghana who can be used to train parents and teachers to identify children with disabilities in the community. And we also want to continue to work with universities to incorporate presently this training manual in the curriculum to enrich the program, because we have a university here, University of Education, which offers program in special ed. And I feel that in the area of vision impairment, we can use this training manual to enrich the curriculum. And we also would continue to work with the Ministry of Education to strengthen and sustain programs for children with disabilities. So on the side of the slide, we have the Actor General of the Ghana Education Service presenting a low vision equipment to the Ghana National Basic Inclusive School. And this attests to the fact that there is that collaboration between the Ghana Education Service and all the directors are behind the picture, the regional director of education, the national director of education, all being part of this. So that's the little I can share with you on the all children reading and what we did in Ghana and the impact that we have and the successes that we've had so far with this program. Thank you very much.
Thank you, Angela. I just want to remind you, if you have any questions for Angela or for the Perkins International Project, if you would type them in the chat box, which is the right-hand side of your screen, and send those through to me. I'll pass those off. I have about 9 minutes left for questions. I'm also going to, while you think of your questions, introduce another Perk colleague that is on call as well. Ann Hayes is Senior International Development Advisor for Perkins International, and she's also on the call today. And I'm going to unmute your line too in case you want to answer any of these questions that we have for Perkins. So go ahead and chat those through to me. I'll start with our first question for you. If you could just elaborate a little bit about the specific innovations within your project that were advanced specifically through children reading funds, and what innovations could be extracted from this activity which could be replicated elsewhere.
So of the that I can talk about currently, the fact that we have this new technology that we brought to the brain, by making sure that they are able to use these devices and equipment. And so what I'm looking at up to is the fact that the braille repair component, where we had these teachers who have committed to repair Perkins braille when they are broken down to also improve the reading of the children, is one thing that we could replicate elsewhere. That whatever equipment you are using in whichever country, if you have these people who are able to help the repair or the maintenance of the equipment, that's a way that we can use to improve it. The other thing is about the competition. It was something that was not done anywhere. And currently, it is not just Ghana. As with all children reading, we now have been able to organize the competition in Nigeria. We've been able to organize it in Uganda. We've been able to organize it in Malawi. And these are all to help improve reading of these children. And so I think that is another innovative thing. And the other thing I'll talk about is the collaboration and involvement of the ministries of education in all these countries. That is a good thing. It's helping us sustain this project moving forward. And I should be able to be replicated elsewhere. It's all the people, the local people like the NGOs working for children with disabilities, and also the government Ministry of Education. That would be a way to go as this project is concerned.
Thank you. Did we have any other questions for Perkins? Just time open a little longer in case there's anyone who questions. Perhaps the next one either for Angela or Ann too. Just wondering if through your project or other efforts, if you've seen expansion of government taking greater responsibility for scaling this or other similar projects from experience.
So let me speak from, because I am here in Ghana. I have seen is that the ministry is actually currently liaising with the mental organizations working for children with blindness and visual impairment to organize the next competition. And that is a collaborative effort. So for me, that is a class. And one of the things I've also seen is that the ministry is also liaising with other international organizations to come in to support, special ed as a whole. And currently they have gone ahead to even work on this inclusive education document that is ongoing, something that is still ongoing with the parliament and all that. So see a lot more of work going into it. And one other thing that is happening is that we have what we call the Marrakesh Treaty, where the organization, the copyright and other people are working with publishers to be able to ratify this convention that we want people with who are below vision to also have access to all past work and books and all of that. So it is something that is really ongoing right. And I feel that these are ways that they are trying their best to make sure that things work well for children who are blind and partially sighted. So,
and I agree. I think there's increased interest from ministers we're seeing in many places to do this, but funding isn't always there. So even in the case of Ghana, they're really hoping to take it on, but they plans to use actual funding, hopefully, that they will be getting from USAID in the future, because there'll be some money passed through to the government directly to do these things. So I think the will is there, the interest is there, and that wasn't always the case, many years ago, but it still has not been incorporated fully into their budget, and there's still a lot of need from, as Angela said, external support, sharing of best practices, and not just, access to technology, but how do you utilize that technology for the population of children who are with disabilities.
I have one last question here, and then we'll take one last one before moving on to the next presentation. The question is, what type of engagement do you have from the parents and communities in the project? Can you expand a little more on that?
With the Ghana Blind Union, we already have systems in place at the districts and regions and all of that. So what we did was that the children in the schools that this project was done, we did have more access to the parents because the parents, live far away from the school and all of that. And so what we did was that we brought them together, and then we kind of divided them according to the district or the area that we can find, maybe 3 or 4 parents, so that they can have the parent group. And what we did was that we came through some basic skills, like orientation and mobility, in how to use the Perkins Braille. This is what we call the Perkins Braille. This is how it is used and all of that. They wouldn't have had the knowledge of how to use it, but at least they know these machines. We showed them all the equipment that was purchased and all of that. And then we brought them together that if the child brings it home, this is how we want it to be maintained. This is all of this. So that was that kind of engagement we had with the parents. And anytime we go to the district or the region, we try to make sure that maybe during vacation or sometimes we can visit 1 or 2 children to find out what is happening. These are things that we are doing, and it's ongoing actually, together with the local organization that we are working with. So that's the kind of engagement that we have.
Okay. I'm going to go ahead and squeeze in one more question here, and then we'll move on. The last one is how can or have you mass distributed your Smart Brailler repair material? Is this open source that their organizations could use and adapt?
It's just the Brailler repair. It's not the Smart Brailler. The Smart Brailler is more of the higher technology, and so it's more of the Brailler, which is often more appropriate for large expansion. So sorry, and Angela, go ahead and answer.
Yes, same. I'm just going to say the same thing that Anne said, that it is more of the Perkins Brailler. That is where we have this Brailler repair. The Smart Brailler is a new technology that has come. It is in about 12 languages, and it's more head. So focus on the classical Braillers. That is what we repair. So that's what we because the Smart Brailler, I think one cost and could give prices. It's very expensive, and you cannot give it to all children at the same time. But the classical Brailler is that you could give to all children. So that is that, and it's what we are expanding for all our children.
And is the manual online, or is that something that just goes hand in hand with the training?
were you able to ask if that's still on the line?
Hello?
Oh, yes. Did you hear the last question?
Sorry, no, because it was just breaking. I'm sorry. One question, please.
Want to repeat your last question? And then
The question was how accessible is the materials for Braille repair? Do we know if we have that manual online, or is that something that is only provided hand in hand with the training?
It is online. It's online. I think through the package for that.
So then it's available on our website, on the Perkins website.
I want to say thank you to Angela Affron and Ann Hayes, both from Perkins International, for sharing with us this morning their project. I wanted to move on to our next presenter to make sure that she has her time today, and that's putting from Save the Children Sri Lanka. Our presenter is Carolyn Ailes Burke, and Carolyn is an education technical specialist working on development and emergency education projects at Save the Children US. She has a master's degree in human rights with a focus on the right to education. And prior to joining Save the Children, she worked as a special education assistant in the U.S. So thank you, Carolyn, for joining us, and we'll let you take over the presentation.
Okay, Shell, I hope everyone can hear me okay. My name is Carolyn Aylesbury, and I work with Save the Children US, but for the last 2 years I've been supporting our Sri Lanka program in designing and implementing our All Children Reading project. For those of you familiar with Save the Children, we are a child-focused NGO working in about 120 countries worldwide, and we work mainly in education, child protection, health and nutrition, livelihoods, AIDS, and governments. In terms of education, we reached about 10 million children in 2013, including about 1 million of which, or more than 1 million of which, were receiving literacy programming. And our statement for the project in Sri Lanka was that children who we suspected had hidden disabilities, so children who may have more hearing or vision impairments or have learning disabilities, or children who are struggling in general in the classroom, they tend to be labeled as slow learners by their teachers and then receive even less support because the teachers see them as the children who are not thriving and not really worth them putting more attention into helping. So we wanted to, through this All Children Reading project, we wanted to develop a set of simple tools for the teachers to use to adapt their teaching style to meet the needs of their diverse learners in their classroom. And to note about the education system in Sri Lanka, they do have a largely, for the most part, more of a segregated system. They're not quite at full inclusion yet, although that is an objective of the Ministry of Education and something we are trying to work with them on. But for the most part, especially in this implementation area, children who have severe disabilities are in special education schools or special education units. So in the general education classroom, we didn't see a lot of children who had more severe disabilities or more pronounced impairments. So we were looking more at the children who didn't necessarily identify right away as having an impairment. Our project was implemented in 15 schools in Minawangota zone, which on the map on the right-hand side is on the upper right side. We worked in 15 schools in terms of our implementation, but we did, through our assessment, which I will talk about in a moment, we did work with an additional 15 schools as control schools. So it was implemented in really close coordination with the Zonal Education Office, so Minawangota Ministry of Education, as well as the Provincial Ministry of Education, and worked very closely with a local partner, the Siddharth Child Development Foundation, to implement our more community-based activities. This project was built on the standard Literacy Boost, Save the Children Literacy Boost model, which is a model for teaching reading and improving reading skills that we've implemented in about 24 countries worldwide. Literacy takes a three-pronged approach to improving reading skills. So there's a focus on improving training for teachers to teach reading. There is a focus on bringing activities into the community so that children can practice and learn reading outside of the classroom. And there is a full assessment component, an early grades reading assessment. We had a baseline in January of 2013 and then complete our end line in October of this year. So that's found for the project, and then our innovation was building on top of that, really looking at those children who are struggling in the classroom. And throughout this presentation, I switched between the terms struggling learners and quote-unquote slow learners. Slow learners is the term that the teachers were using to describe the children who were falling behind in their classroom, but it's not a politically correct term, and it tend to use the term struggling learners, meaning more generally children who are struggling. Our focus was to really try to improve the reading skills of those struggling learners in the classroom. And our main innovation was around those tools that I mentioned, tools for teachers to adapt their teaching style. But really that session spread to four main aspects of the project. So the first adaptation from Standard Literacy Boost involved screenings for children who may have more mild hearing and vision impairments. So we screened, I believe it was all children in the grade 2 class, because our project was tracking children from grade 2 through grade 3 from 2013 to 2014. We screened more than 500 students for hearing and vision impairments in coordination with the Ministry of Health. And then I believe it was 21 children ended up being diagnosed as needing glasses, and 2 children were identified who needed hearing aids. So we were able to provide that assistive technology to those children. We also had the intention of conducting a full diagnosis of all children who were identified as struggling, to see which children, if any, had learning disabilities, and if so, what those disabilities were. We found out pretty early on that that was not really feasible in this context, and in fact in the majority of contexts, given the really involved diagnosis process for diagnosing a child with a learning disability. There's a lot of student observation that needs to take place. The child typically needs to take an IQ test and then an individual assessment with a child psychiatrist or a special education specialist. We met in December of 2012 when we were really working on launching the project and designing the tools. We met with some child psychiatrists in Colombo who were having a lot of the diagnoses of learning disabilities in Colombo, and they actually request not to refer the children in our program to their office for diagnosis, because there were, I believe, 2 of them, and we were talking about hundreds of children. So pretty early on, we had to shift slightly to look at how we can actually get a clearer picture of the challenges of the children who had been identified by their teachers as being quote-unquote slow learners. And we did that by developing our own screening assessment for, we called it the Learning Challenges Screening Assessment. And it was not diagnosed children. We did not come up with any labels for children based on this screening. It was purely to get a clearer picture, because the teachers had told us that these children were falling behind, and we did have a lot of teachers who, and we've seen this in other countries as well, where teachers assume that the child is falling behind because they have a learning disability. We wanted to really dig into that issue a little. So the screening assessment looked at challenges in 5 different categories. Well, categories that are associated with learning disabilities, but then a 6th category of sort of background home environment issues that could be causing struggling in the classroom. So language and learning challenges, mathematical reasoning challenges, social behavioral challenges, physical impairments, and daily living skills. And we'll look at some of the results of that screening assessment on one of the next slides. The second main adaptation that we made to focus on struggling learners was the addition and the creation and addition of a new teacher training session specifically on struggling learners and how to support diverse learners in the classroom. And this session really introduced the the tools, that is the next item on the list, the tools that we had developed to help teachers think through how they can support children in their classroom who have learning disabilities. And then we worked with teachers to establish some catch-up classes for struggling learners to give them some extra contact hours in the classroom. So the real biggest part of the initiative that I mentioned was these tools that we developed for the teachers. Actually, they were 4, but we had kind of consolidated 2 so that it's really 3 main tools now. The first was a pre-screening reference sheet that we asked teachers to use when they identified a child who was struggling. So I mentioned earlier that a lot of teachers sometimes jump to the conclusion that a child is struggling because they have a learning disability, and then that there is nothing that the teacher can do to support that child. And the first tool helps the teacher think through the types of external factors that really could be causing that child to struggle in the classroom, because it is frequently, not most often, not an actual learning disability. It could be that the child is not being supported to learn from their parents. It could be that their attendance record is very poor, that they don't speak the language of instruction at home, that they live in an abusive family situation. So we ask teachers to really think through these different situations first. And if they identify that one of those situations does describe that child, the tool gives them a list of suggestions on what they can do to support that child. So whether that's refer the child to a specialist, meeting with the parents to really try to get to the bottom of the conditions that might be causing that child to struggle. If it works through that first tool and thinks that none of those external factors really apply to this child, or maybe they do apply but the child is still struggling after the teacher has tried to help address those issues, the next tool and the real meat of this training package is the Strategies and Accommodations reference sheet. And this is a tool that is designed to be kind of a quick reference guide for teachers to identify simple strategies they can use to support struggling learners in their classroom. And when we had envisioned this guide, we had thought of it more as a fact sheet of different learning disabilities, and we had wanted to have a sheet for what you do if you have a child who has dyslexia, what you do if you have a child who has ADHD. And due to the challenges I mentioned in the previous slide in terms of actually diagnosing and identifying the specific disabilities that children may or may not have, we found that was not going to be possible to have the strategy sheet organized by type of disability. We also found, and in our discussions with people working in special education, with different teachers, with the child psychiatrists, we to question the of having that label for a child in an area where there is not a lot of extra support that can be given to that child. Areas where there are special education teachers who are trained in the specific types of disabilities, then there is definitely more value in having that formal diagnosis. But if the teacher is kind of on their own in the classroom trying to support the child, it seems extra step to have them try to identify the label that goes with the challenge the child has, and then try to identify potential strategies that go along with that label. So we took out that middle step and had the teachers just focus on identifying the challenges that the child has, and then gave them strategies, very simple, straightforward, low-cost strategies to address that challenge that the child has. And this also helps avoid mislabeling, as well as the child against having being diagnosed with or labeled with a specific learning disability. And it encourages teachers to think more broadly about children as individuals, because we had a lot of feedback about teachers who were given the diagnosis of or diagnoses of children with learning disabilities in their class. They're more likely to think, okay, well, all of these 4 children have dyslexia, so they need be treated the same way. They need the same exact accommodations, and that's really not the case. All children are truly individuals, and regardless of their individual learning impairment, whether or not they have one, they do need to be approached as individuals, and we did want the teachers to think individually about each of the children. Then the last tool that we developed was an individual student information sheet, which is basically a very, very simple individual education plan for the teacher to keep track of what strategies they have tried for the child and what strategies worked, as well as what is a goal for that child to reach by the end of the trimester related to the challenge that they are having. In addition to these tools, we did have the Learning Challenges Screening Assessment that I mentioned earlier that really was not given to the teachers. It was completed with the teachers. So it was part of our baseline assessment. We see teachers as proxy reporters for the students who are struggling. So we, during this line assessment, asked the teachers to identify who the children who we sampled were the quote-unquote slow learners that they had been talking about. And we gave them a little extra guidance. If they didn't already have the answer ready, we said that we're talking about the children who have difficulty with their letters and numbers. And this took place in the beginning of the children's second grade year, but the way the education system works in Sri Lanka, the teachers had already been assigned to those children throughout their first grade year. So they'd spent a year with these children and knew them quite well. The results of that first Learning Challenges Screening Assessment, we, under each of the categories, we had about 4 or 5 indicators that ask if a child could do an activity. So I believe remembering when their letters was one, instructions, paying attention. And for each question, each indicator, we asked if the child had some difficulty, a lot of difficulty, no difficulty, some difficulty, a lot of difficulty, or cannot do at all. And then a child screened positive on the indicators if the teacher said that they had a lot of difficulty or could not do at all. And here we see the children who screened positive in each of these major categories by screening positive on 1 or more indicator or 2 or more indicators. So you see that the biggest area where children were struggling in was language and learning challenges. This is the results of our N-line assessment. So the gray bars show the scores that children had on the baseline Literacy Boost early grades reading assessment. And then the colored bars on top are showing the progress that was made. And this is for the 15 implementation schools and the 15 control schools. So the control schools did not receive an intervention. And we're trying to see what the progress would have been if we had not implemented this project there. You see that we had not a lot of progress on the lower level skills, so understanding how a book works, knowing your letters, knowing words. We did have more progress, meaning that the red bars, the implementation schools score made more progress than the control schools, and that was statistically significant under fluency. We saw a lot of progress there. And this is showing just all children, so all children who received the intervention and all children from the control schools, not just the struggling learners. When we look more closely at just the struggling learners, we see that, and this is just the fluency piece, we see they made even more progress relative to their control group peers than the overall classroom altogether. And then when we go even deeper to look at just those children who screened positive initially on language and learning challenges, we see an even more stark contrast between the implementation schools and the control schools. And you see that the children with language and learning challenges, so those are children that we suspect may have a learning disability, they scored higher than their control group peers who screened positive for language and learning challenges in every skill and made a lot of progress in actually closing the gap between the peers in their schools who did not have, who were not slow learners. The lessons learned from our project, well, the first main one was the one that I already discussed related to the barriers in actually diagnosing the children with learning disabilities, as well as the usefulness of that in areas where the support systems exist and there are not experts on those specific disabilities. And because we had these tools to be scalable, we definitely wanted to make sure that they weren't tied to a diagnosis process that was not really possible everywhere. We also found that the designation of slow learner, and this was not entirely a surprise, is very subjective when the teachers have identified who their slow learners are. We found this out because at the line we asked teachers again to identify, so this was the children's third grade teacher, we asked them to identify who the slow learners were, and they did give us a slightly different group between baseline and end line of who who teachers in third grade were considering slow learners. So that's very interesting for us in how we engage with teachers and really work with them on biases that they might have, as well as support children who are struggling in their classroom. And then lastly, this is not a surprise to anyone. Sure, teachers do really need a strong commitment to being inclusive and to working with the children who are struggling in their classroom. We develop the tools to be as simple and easy to use as possible, and to require few resources, if any resources, but those tools are not useful, and the teachers are committed and focused on using them. And then lastly, our next steps, we have already begun a replication of the project in northern Sri Lanka in the post-conflict area, where that began very shortly after the All Children Reading project, and that running through 2016. So we're hoping to have some more learnings out of that project. We've been able to scale up the tools in 2 different locations in Indonesia. We're hoping to plan some more assessments to really look more closely at the tools and to see how we can support children who screen positive in other areas, as well as to measure the impact of the tools on their own without the Foundational Literacy Boost project. And then we plan to continue revising the tools based on the feedback that we get from those implementation areas, as well as sharing them in different inclusive education trainings that we're giving around the world. So a little bit over on the presentation part, but if anyone has any questions, I would be happy to address them.
Thank you, Carolyn. Just a question on slide 4. You went into a lot of details about the different tools that you had. Is there any way for participants to see those tools a bit closer? Is there access to those for others? If you'd share a little bit more about that.
Yeah, definitely. They were, so the screenshots I have on the slide here are the draft versions that were being tested in this project. We are developing more finalized versions, and I'm happy to share them with anyone who is interested in we've not posted online yet because they're still kind of being finalized, but since this was USAID, I believe they'll be in the, or a portion of them will be on the development clearinghouse, and I'm happy to share them individually with anyone who is interested in looking at them. I'd print them out so I could read through some different sections for people, but I did run out of time. But it's basically the first 2 on the left are kind of two-column graphs, so or 2-column charts. So on the left side is a question about a behavior the child might be showing or a challenge the child might have, and then on the right side is 5 to 7 really simple strategies to try to address that challenge. And that's not taking into account any, or not assuming that the teachers have any access to special technology or to special specification specialists. It's really very basic things that any teacher with the basic level training can do.
Okay. And also, I think that you might have addressed this, but just to clarify for a question coming in, was your learning challenges reading assessment developed specifically for this project, or is that something that's been adapted?
Yes, that was developed specifically for this project, and it was adapted from, in part, we were on the design of the Washington Group on Disability and the UNICEF classification of disability tool that was developed in 2012, around the time that we were working on this. So the indicator scoring option I mentioned earlier of no difficulty, some difficulty, a lot of difficulty, can't do it all. Those are adapted from the Washington Group's tool. We also do on different screen tools that we had seen from different programs around the world that had been to do something similar, but actually putting it into these categories and really trying to get at those 5 grouping challenges was developed for this project.
Can you clarify also what your thinking is on a path to scale this initiative? Is there government support, even rather locally, to expand the resources you've developed to other schools?
That's a great one, and I should have definitely put that into the presentation. But when I was last in Sri Lanka in October of this year, Minnewangoda Zone, the Ministry of Education for Minnewangoda Zone, had informed us that they were planning to scale it up to all 149, I think it is, 149 primary schools in the district. So they were very pleased with how the project was run, how the teachers were behaving, and they wanted to take it up on their own. Actually look, and in moving forward in the 2015 school year, it remains to be seen, since they won't have the financial backing of Save the Children, but the tools themselves are very low cost and just need to be printed. And we worked with the Ministry of Education to deliver all of the training, so their trainers have already been really well introduced to the tools and the training material.
Question. If you could go into more detail perhaps on any other local NGOs or other organizations that you were able to attract to support this project or and be a part of it?
So the main NGO that we worked with was the Siddharth Child Development Foundation, and they the activities in the community. So we had, and they worked with communities to lead those activities themselves. We had reading clubs for children in the community. We had some training on supporting their children in reading, and they really took the lead on all of that. We also worked closely with this was in late 2012 when we were really developing this project. We worked closely with a disability-focused NGO in Colombo that had developed. It was a resource center for parents to take their children who had severe disabilities to come and specialists and other parents and other children in that area. So we had worked with them. They gave us a lot of ideas and guidance on directions to take the project and to take the tools, but they're not actually involved in implementing.
Last question for you, Carolyn. Just wondering if your screen data or any of the data you've been collecting can be captured. Do you have any tools in place to capture that on mobile or other devices, and then reviewed through some days? Or what type of tools do you use for that?
So when we did the original baseline, we were using pen and paper assessments, but then for the line in October, as well as for the replication project that I mentioned in the north of Sri Lanka, which started in about April or May of 2013. Those were all done completely electronically. So we were using the Tangerine assessment on Google tablets to collect all data, both for the EGRA, which is conducted, the Literacy Boost EGRA is conducted with children, and then when we were surveying the teachers to get information on the types of challenges children had. Those were all conducted on tablets and then uploaded to a spreadsheet.
Okay. Thank you, Carolyn, and your colleagues at Save the Children for your work on this project. We're just near the end of our time here, so I'll close the questions for now. So I just wanted to thank all of you again for joining us for this Autumn Reading a Grand Challenge for Development Innovator Spotlight on this day that we are specially observing International Day of Persons with Disabilities. I want to say a special thank you to all of our presenters for what they've shared today, and to our presenters and participants for the work that you each do to enhance literacy, especially for children with disabilities. I wanted to invite you to sign up for our newsletter on our website if you'd like to hear of upcoming events like the one today or other events, and of course other competitions that we might be offering through round 2 of All Children Reading. Or also if you'd like to follow us on Twitter, our handle is at ReadGCD, GCD standing for Grand Challenge a Grand Challenge for Development. So if you'd like to follow us or contact us through in those ways, we invite you to do so. As mentioned earlier, this webinar was recorded, and as soon as WebEx has finished that recording and sent it to me, I will forward it onto you for your use. It will also be on our website under Webinar Archives as soon as it's available. And to all of you for joining us, and look forward to having you again on our next webinar. Great day. Bye-bye.